Welcome back to another episode of the Nameless Recovery Show. I'm your host, Estelle Wallace. Today we've got Brian Whitmer, who is currently Chief Operating Officer over at Calvary Healing Center, a beautiful institution, been around over 50 years. Brian, welcome.
Thanks, Estelle. It's great to be here.
Really glad to have you today.
Yeah.
So, as we talked about a little bit, there's no real format. I just want to ask you a whole bunch of stuff. Feel free to answer or decline anything that I ask.
You got it.
Hopefully we can get out there and talk about addiction and recovery.
Right.
First of all, let's start with some of the basics.
Sure.
So you're an executive at a big treatment center.
Yep.
Part of the big conglomerate, healthcare conglomerate. Tell me a little bit about why you're in this space. Why do you work in recovery?
Ultimately, it's because I am in recovery myself. So That was how I got started and wanted to give back. And that was, I had a friend who I ended up getting sober with from when we were in high school, and he kind of recruited me over to Calvary, and it was kind of taken off since then. It was really exciting when I got to Calvary in 2009 to just be a part of it. They were coming out of being a family-owned business, and it was exciting when we first got there because we were all kind of creating this new entity. We didn't have our detox. We didn't have any of our levels of care. In 2008, we had 17 employees, and we're averaging like 5 patients a day. And I think our parent company was trying to figure out what they were going to do with us. And we had a different CEO at the time and who had a big vision and kind of put Calvary on the map. So
it's pretty awesome. It's been a fun ride, even as a fly on the wall. I've been around and been sober quite a while, and referred a lot of people over there, and sponsored guys out of there, and come over there, and been asked to speak over there quite a few times over the years. And Calvary's a great place.
Yeah, absolutely.
So, what was your first position there?
I started out as a behavioral health tech.
Awesome.
Yeah.
Gopher. Pea collector.
Gopher, yes. Pea collector, fight breaker upper, rule enforcer. Yeah.
So then, over the years, because you're now in the C-suite, so you've worked a lot of positions.
Yep.
So as an operations guy, you really understand treatment.
Yeah.
Soup to nuts, balls to bones.
Yes.
What's one of your favorite things about working in treatment?
My favorite thing is watching the patient get better, because in a lot of different medical settings, especially in behavioral health, people don't get better, and that's probably the best part. Is somebody comes into detox, and I often remind people that people are calling Calvary on the worst days of their lives. They're not calling us because they're having a good moment or in a good spot. And so at the end of the day, what we're shooting for, is recovery and people getting the message and giving them some tools so that they can jump into that toolbox, and when life kind of meets them head on with the challenges once they discharge from Calvary. So when I used to run orientation from an HR perspective, I'd say, this is a lot different than a psych facility, because people generally get better and they'll come in and detox, and then 30 days later they're a completely different person, full of hope and excitement and kind of on fire for life. And that part is kind of the miracle best part about working at Calvary. I'd probably say the second best part is the patients who come back who want to come work for us. So that's probably the coolest part, because I feel like they have a lot more buy-in and leverage with the patients that are sitting there. The person who wants to leave early is missing their friends or sad and lonely. I think that our techs and therapists who are there can really, say, I was in room 19. I know what it was like. It's like I've been there, and you can get through it, and we're only talking about 30 days.
How important do you think that is, the I've been exactly where you are and been through exactly what you're going through? How important do you think that is to recovery?
I think it's everything. However, we obviously hire people who aren't in recovery, but I think what we instruct people is to be honest, because the one thing that I would say is the 12-step community does not have the market cornered on pain and suffering, and we're all kind of living this human experience. And so just because I'm not an addict or an alcoholic does not mean that I can't understand where somebody's coming from. So that's what I really try to get our non-recovery folks to kind of key in on.
Sure.
So
it is powerful, though, hiring alumni.
Totally.
It's really cool. Like you were talking about, I know what it's like to be in room 19.
Mm-hmm. Yeah,
that's powerful.
Yeah, it is, and it's so helpful for I think the patients, because they get it, they understand where this person's been, and also too, sometimes we have to remind our staff as well that this person may be a challenge right now, but you might have been a challenge too.
Mm-hmm.
And we gave you a chance, and so it's kind of reframing,
I'll tell
refocusing.
Them that. We've got we're a team of 16, and we have 4 alumni that work here, and I'll tell them in a second, man, you were a shit stick when you were here.
Yeah, pain in the ass. Yeah, exactly. And at the end of the day, what we try to remind people is like, we have taken away a coping mechanism of drugs and alcohol that may have been a big part of their life for a lot of years, and now all their feelings are coming to meet them, and life is meeting them head on, and that a person acting out is doing exactly what they're doing, is exactly where they're supposed to be, and it's our job to help redirect and reframe and refocus and stuff. Because the one thing that I will say is our goal is to try to get people sober, but if somebody relapses, I hope that they see the BHT or their therapist when they were drinking, and that they feel guilty, like they've let somebody down and we've ruined their drug and alcohol high.
Yeah, absolutely.
So they may not get it always, but if we can ruin their high and they can't get high normally like they used to, then we've done our job too.
So you've been in Calvary. How many years is that?
10 years now.
10 years you've been working at Calvary. You've probably seen a lot come and go. Have you ever seen anything like this coronavirus? Have you guys ever been under pressure like you are now?
No, not at all. I mean, there's nothing. One thing that I've talked a lot about with a lot of friends is that there isn't a person alive currently that's ever experienced anything like this right now. So it's not generally with people who are in recovery, we have an opportunity to try to lean on somebody for their past experiences of like, how did you get through this? And there is not a playbook kind of drawn up for any of this stuff. So it is certainly an emotional roller coaster, and the coronavirus is, I think changes our messaging, because we tell people once you leave us, to go to as many meetings as you can, hang out, have groups of friends, because our population is mostly young people in recovery, and that is I think the most important part is having the friendships and the relationships, and governments telling everybody to do the opposite, isolate, hunker down. So
you're touching on what I see as a really, really sore subject, and I think it's important that we talk about it. The 12-step fellowships. We can unpack their role in rehabilitation and recovery.
Right.
Like somebody's on the rocks. They're in bad shape. They need to go to a detox. Even if they go to a hospital because they don't know where else to go, they'll usually end up in a detox facility, something like what Calvary has or other places in town. From there, they'll go hopefully through residential. Maybe they'll do some outpatient. Hopefully they'll do sober living and join 12-step groups. That's what everybody in treatment hopes, is that they will join a 12-step fellowship, whichever one best suits them. Insurance companies, when authorization runs out, almost 10 out of 10 times says patients should join a 12-step group.
Agreed.
We are in, I'm trying to think of how to say this without sounding too offensive. Not to you, just to anybody listening. But we are, for the first time, maybe ever, since the birth of 12-step groups, I think we are actually in some reasonable amount of danger of it dying. 12-step groups are underground. I mean, there's Zoom.
Right.
And for some people, especially people that have a little bit of recovery, or people who prefer to isolate, and there's nothing wrong with that. I think for those folks, it's good enough, sort of. But when I look at the population as a whole, I'm talking 15 to 20% of the human population suffering from addiction. Zoom just doesn't fucking cut it.
No, not at all.
We're being suffocated of human connection, and human connection is what this whole thing is about. It's how people recover.
Yep, I would agree.
Yeah, so we've had the same challenge at Cornerstone. I've had the same challenge in my own personal life.
Sure.
Where do we go? What do we do?
Right.
How are you, first of all, let me ask you that, how are you navigating personally? since you're in recovery, what do you do for 12-step meetings? How are you doing the Zoom thing? Mm-hmm. Are you meeting some people in backyards or anything like that out in the park?
Yeah, it's been all of those. the social distancing, coffee hookups in the park or whatever, and in Zoom meetings. And so I've got my home group is a men's fellowship, and so that's been moved over to Zoom, and that's primarily where we're going. So it's Zoom meetings and reaching out, calling people all the time. That's really leaning on my support group more than anything else.
That's good. And what type of advice, type of guidance are you guys offering patients that are exiting treatment?
It's tough. For one, while they're inpatient, generally what I tell them is you're probably safer and you're going to get more recovery by staying in treatment than you are when you leave. Since this was back in March and April when
100% agreed.
When most of the meeting halls were closed, it's like, if you think that you're going to leave here and it's going to be great, everything is shut down. You're not doing anything, and the reality is that you're going to get more recovery here. You're going to get more things to do and keep yourself occupied than you will when you discharge. So leaving early is not a good plan.
No.
So I think we're still are trying to get people to step down to sober living. I think somebody stepping down to sober living versus going home to a private apartment would be a problem. So I think that would be a bigger issue more than anything else, because that isolation is such a killer of this disease. So
it really is, and people are isolated like never before.
Correct. That's right.
It's such a strange dynamic. If you think about all the uncomfortable and horrific things the human race has been through in various times throughout history.
Right.
This one's super awkward. It's not necessarily any worse or better than anything else. I don't even want to compare it to other things.
Sure.
It's just totally different than anything else we've been through.
Right.
It's an airborne virus, which we have all the technology in the world to connect us in all the other ways.
Right.
But the one thing that matters, especially to somebody who's suffering from addiction, the one thing that matters more than anything is the one thing we're not supposed to be doing, and that's sitting within 6 feet of each other having a real conversation.
Right. You talk about the fellowship hugs or whatever, those are all part of it, is how do we have that human connection. I completely agree.
Well, and I agree with what you said. I think for someone who's struggling to get sober, I think treatment is probably the safest bet you could go. You could go with. You're going to be more recovery focused. You're going to be more recovery centered. You're going to be working with people that are in recovery.
Exactly.
It's going to be all dedicated to learning how to live sober without those substances.
Exactly. And drug addiction and alcoholism has killed more people than coronavirus has ever. So at the end of the day, that's an important reality that we need to kind of hammer home to our patients.
It's astounding. And on this particular show, I don't get into politics, because this issue that we're talking about will likely consume all of the energy that I have.
Right.
And it's what I care about most. Just for those that are listening, to give some numbers of what Brian's talking about, in the month of May, I'll back up. Current numbers, 2017 and 18, we were losing about 400 American citizens to drugs and alcohol every 24 hours. That's a 747 full of people crashing and burning every day. In April, that increased by like 15%, and in May, it increased over 42%. That means we're losing north of 550 American lives every single 24 hours to something that's completely treatable, completely preventable. And it takes, and you can watch people, contract it. People that have the propensity for it, you watch them go down this road. If it's your kid, if it's your lover, if it's your spouse, if it's your parent, if it's your coworker, if it's your employee, you watch them go through this. If it's your client, you can watch them go through this. And what kind of interventions? How do we stop it? These are the questions we try to answer in recovery. These are the things we try to do to try and stop more lives from being lost. And our most powerful weapon is this. It's human. It's human connection.
Well, I think it felt very validating to see the New York Times post that article a couple months ago talking about that 12-step recovery is the most effective treatment, most proven treatment. And it just felt vindicated because so many people have gone other routes and other directions and saying this way will work, or harm reduction. And harm reduction is important. I don't want to minimize that, but at the end of the day, number one thing.
Let's talk about it. Let's talk about harm reduction.
Okay.
I have my own opinions, as I know you do, and I think it's a subject worth talking about.
Right.
So first of all, can you define harm reduction for us?
So harm reduction would be, at the end of the day, the goal is so I guess harm reduction would be that the person is not going to end up dying, and so we're going to try to mitigate any chances of somebody overdosing. So, for instance, primarily with opiates, we would try to get somebody on Suboxone and do that. And in the 70s, it was methadone treatment.
It's methadone again today. 2020.
Methadone, that's right. 2020, methadone hasn't gone anywhere. It just is. Methadone is such a dirty drug. It's so hard to detox. I've had patients who say it's worse to detox from methadone than any of the heroin or opiates that they've done and stuff too. So harm reduction means, is it better to tell the mom of the heroin addict who's going to discharge that they should have Suboxone, or that they could potentially leave and they'll go relapse and die from a fentanyl overdose? And so generally, the thought process is that it would be better that somebody should be on Suboxone maintenance versus the potential of go relapse. And so, right? Am I missing?
No, I think that's a pretty good definition. We're trying to reduce the amount of harm, the risk of overdose and death, shortening of human life via overdose. I
think the thing that gets muddied in there is the messaging is the issue more than anything else, because I can get behind the harm reduction, but I think the messaging says, what's your end date? What's your goal date of stopping Suboxone or Vivitrol or any of the other modalities that are out there? And still hammering home, it's a spiritual program, and this is how.
Let's talk about each one then. So, can you explain the difference between Vivitrol and Suboxone?
So, Vivitrol is a shot in naloxone, and it blocks the neuroreceptors in the brain from getting high.
So I can shoot heroin and not get high.
That is correct.
I have known a kid that was dope sick because he was trying to get high, trying to break the seal or whatever. Shot dope for like 2 weeks on a Vivitrol shot.
Got it.
And by the time he ran out of money, he was just dope sick. Still couldn't get high.
Got it. That sounds horrible.
Sounds
like my worst nightmare.
Yeah.
And then so Suboxone is going to be more of a pill form, and it's also. With Suboxone, I guess in theory you can only take so much, so it still can be abused. And so, but my understanding, I've never taken Suboxone, is that it would you kind of hit a plateau with Suboxone. So again, it's going to block some of those neuroreceptors, and it gives the brain and the body the feeling, not necessarily the feeling, but it stops the withdrawal period.
Because Suboxone is a combination; it's half opiate blocker, half synthetic opiate.
Yep.
So you get a little bit of what you want, and you get a little bit of blocker.
Yeah.
So it's used to detox, get somebody off of an opiate over a longer period of time with less of an impact.
Correct. Yep, and that's my understanding of it as well too. And so that would be the harm reduction model, and so it's pretty controversial in 12-step meetings. You'll get your crusty old guys who are like, you're not sober, and then you have the new generation who are saying, how else am I supposed to get sober? So I think it's taken me a minute to evolve on this too. So, because I don't, at the end of the day, what I would say is I'm not here to define anybody's recovery. So if somebody says that they're sober, but they're not shooting heroin and they're employable and they have a long-term goal.
It's interesting. There's and I'm happy to just share my opinion on it.
Sure.
I think the introduction of Suboxone and Subutex, which Subutex is just the synthetic opiate, doesn't have the blocker in it. It allows. Obviously, there's use cases for it. Same concept, though. The idea is to get off of the illicit substance onto something that's managed and controlled by a physician, and then taper down over some period of time. So this is my view on it. It's a mind-altering substance, so you're technically not sober. But if you check into detox on January 1st, and you get on, and you're an opiate addict, and you're taking fentanyl, and you get onto Suboxone, and you're taking Suboxone for 3 months, I don't care, 3 days, 3 months, doesn't matter to me, and you at some point taper off like you're prescribed, you learn how to live a life inside of abstinence-based recovery, then your sobriety date's January 1.
Right. Yeah, exactly.
The flip side of it, I think, is where people want to get onto the harm reduction model. They want to get into a Suboxone maintenance,
right,
and just say, you know what, I'm just going to take this.
Right.
I'm going to do this, not in addition to, not as an aid to recovery, not as a tool for abstinence. I want to take this in place of doing anything else.
Correct.
I don't want to take these pills anymore. I'm going to take Suboxone, and I'm going to clean up my life. That's fine if that's someone's choice. I'm not here to tell anybody what they can or can't do.
Right.
But when that guy walks into a 12-step meeting and says, yeah, I've been sober for a year, that's when I started taking Suboxone.
Right.
Yeah, you don't even have to be crusty. Somebody sitting next to him who's doing a bunch of work is going to be like, you're not totally fucking sober, bro.
Exactly.
You know that, right?
And I would agree with that too. I think harm reduction is a setup for people feeling like they're doing something without ever changing their behaviors or their mind thought, or their mind, I guess, changing their process.
Well, and you nailed it when you first started talking about this. I think the communication is where the gap is. There's too many people in the medical community that are prescribing this, like, hey, you don't have to, like, this is the answer.
Right.
Look at the statistics.
Right.
They're off the charts. The recovery rates with this is huge.
Right.
The trouble is they're calling a medication recovery.
Correct.
The other side of the coin is then you've got people in the rooms of recovery that are like, you're not sober.
Correct.
So who are we harming?
Right, exactly. And I think how many people have ended up dying from bad advice from 12 steps. People in 12-step recovery are saying that you're not sober instead of being more welcoming and bringing people in. You know, because at the end of the day, I think the only desire for the only desire for membership. I've got it backwards. Yeah, the only requirement for membership is a desire to stay clean, right?
Right.
So I mean, if that's the only requirement, then why are
so I've heard.
Yes, exactly. So I've heard. Right. Yeah. No opinions, principles versus personalities. So that part is the goal right there, is to focus on trying to be more inclusive and open, you know, and keep coming back is the message, right? So
right. And in a time where we're losing 5,500 lives a day.
Right. Exactly.
A day.
A day. Right. Yeah, it's unbelievable.
And it's not, you know, in 2017, this was making headlines. People were like, holy crap.
Right.
And not to get off too far from a tangent, but that's frustrating in and of itself, that it took middle class 20-year-olds dying of fentanyl and other opiates to really get national attention, because people have been dying from drugs and alcohol for as long as we've had them.
Exactly.
2017, I think in general, the country kind of came to a place where it's like, holy crap, this is actually happening to our families. Right. This is happening to our employees, our employers, our colleagues, our friends, our kids, our spouses. And we started to make some changes. Right. And I got to tell you, we were trying to get it down from the 400 a day number, and it's jumping. Right. Everybody's staying home. Right. People are out of work. People have stay-at-home orders. There are businesses shut down. There have been protests in some cities, riots. There's civil unrest. There's people feeling disenfranchised. There's people feeling angry. I mean, you add all these things together, we've got like a perfect storm for mental health problems. Suicides are through the roof. Addictions through the roof. Yeah, this is a crazy, crazy time we're living in.
It is, and that's something that my wife and I have talked a lot about, is that, you know, that a lot of what we're seeing right now is mental health that is untreated, and it keeps building upon itself and compounding, and we keep creating more technology that's supposed to bring us together, but it keeps us further apart. And so again, going back to your topic of it's that human connection, and so that's the biggest piece. And you know, at the end of the day, harm reduction is what insurance wants, because that helps pay their bills, and also, you know, people stop going to treatment and they can just get stuck on Suboxone forever. Yeah,
sure. Well, it's inexpensive and effective.
Yes, exactly. That's correct. Yeah.
The question becomes, when we talk about effectiveness of anti-craving medications, I think the question really needs to be like, well, what are the metrics we're using to judge effectiveness? Right. And I think better data collection across the board within treatment. It's hard to do within 12-step fellowships because they're completely nonprofit, they're completely volunteer. But within the treatment space, I think better data collection, better outcomes data collection is critical. So that over time, because it's not one thing. You know, I have a hard time getting behind anyone who's like, oh, I have the answer, it's this. Like, we're talking about behavioral health, and it's fucking complicated.
Right, it is.
So there's often a combination of substances, psychotherapy, family therapy, EMDR. We're talking about childhood trauma. We're talking about learning healthy habits. Like, what time do you go to bed?
Right, exactly.
Just at face value, you may see someone, like we were talking about earlier, the client who's a shit stick, right? Well, I got to tell you, if you do a little assessment, you might find out that kid consumes 800 milligrams of caffeine a day, consumes almost no calories other than energy drinks and Twizzlers, and sleeps like 4 hours.
Right, exactly. Has no discipline, has no routine, nothing in place.
Not to mention all the other stuff.
Yeah, exactly, right. Exactly, that's correct.
Not to mention fixing everything else. Right. We have to teach this young man, just like someone taught you, and just like someone taught me.
The foundations,
How to, even if I don't believe it, even if I'm so sick, I don't believe I'm worth salvaging, at least how to physically go through the motions of some self-care. Eating decent food, going to bed at a decent hour, getting up at a normal time, getting some exercise.
Right. And I think the most important thing is defining what recovery is, because everybody has a definition, but I think that even if you break it down as simple as possible, is saying that recovery is attending 12-step meetings, having a sponsor, the exercise, the spiritual component, going to meetings and having a home group and being of service and having service commitments are all kind of those foundations that I think people want to gloss over, and those are almost the critical pieces for you. Just do the simple stuff. When people when I was first getting sober, the first thing was, I don't care, all you need to do is get there early and empty ashtrays. And I was like, I don't understand how this is going to help anything. I don't even get this.
That's the Mr. Miyagi stuff.
It totally is. It's the look over here, don't focus on yourself. It's getting outside of yourself, and I think that's that's kind of the foundation for this recovery.
That's an interesting principle, getting out of myself. But that's very difficult to do when I'm suffering and I'm the cause of all my problems.
Absolutely.
And no one wants to be around me, and I'm starving for their love, and I'm suffering. That's interesting. Then one of the first tricks we do is get me to focus on someone else's well-being.
Exactly. That's exactly right. Focus on somebody else. And, it's such a true statement, is talking when you sponsor somebody or if you are of service. And that's one thing that we can say to the newcomer is, if you got 48 hours sober, you got more than that person who came in who has 5 minutes. And you can share your experience, strength, and hope of how you've stayed sober for those first 48 hours. And that has been foundational for my recovery. Is when I think that I'm having a bad day, is part of that is reaching out, and whether it's talking to sponsees and taking people through the steps and reminding myself for where I came from. But the flip side of that is, I could be having a bad day and then I talk to a sponsee and I'm like, oh yeah, I got it good. They're going through something that's way worse than I am, and that's part of the sponsorship, is like, maybe I'm a little bit further down the path and I can remind them of, like, I got to here and I made it through. But I needed to be reminded of how terrible I felt at one point to kind of get me outside of myself and just get a little dose of that gratitude, and I think that is that getting outside of yourself, and so even if you don't have a long time, you still have some sort of experience, strength, and hope that you can share to somebody.
Absolutely, and it creates that perspective change.
That's right.
Because then it's not about me; it's about, how can I help you? You're having a hard time. How can I help you?
Right. Especially when we're getting sober, we're thinking we're still looking for that magic bullet. And what I've figured out over time is, it's not the big shifts; it's stuff that happens in the margins. It's very small, incremental stuff. So if I let go of a lot of my little, like, daily habits, then all of a sudden I'm wondering why I'm having a bad day, and it's like I go back and I look at all those small things that I do on a daily basis for daily maintenance, but that takes some time, and it's how do we convey that message to that newcomer of, like, how do they really, I wouldn't have understood that until I've had to experience it and stuff too. So
this is a good topic. So when you're young and you're drinking yourself cross-eyed daily, or smoking fentanyl pills in a bathroom, and you're 20 years old or whatever, life looks long.
Right.
Even if it doesn't look that bright.
Right.
You got time to figure things out, land on your feet, and you can procrastinate. Getting a little older, I think somewhere around the age of 30, when I was just a few years into recovery, I had this overwhelming sort of aha moment. It was like, holy fuck, like I'm not gonna just. The first aha moment was like, oh, I'm not gonna be dead by the time I'm 30, because here I am.
Right.
Looks like recovery's working.
Right.
And then it turned into, well, what am I gonna do? While I am gonna make it, it is limited.
Right.
Every day, the things I do and equally the things I don't do are what make up the fabric of my experience here.
Right.
So what do I spend, if I'm awake 18 hours, what am I doing?
Right. Where are my
16,
thoughts for
hours,
those?
What am I doing?
Yeah, exactly.
Yeah, what are my habits? When I get up, do I get up and my friend Andy calls it the wolf brain.
Right.
Do I wake up and let the wolf brain just start fucking attacking me and I don't have enough and I need to get more and I need to, or do I wake up, take a minute, don't look at my phone, get into a meditation, spend 10 minutes in quiet meditation before I make breakfast and talk to my kids, and those are big shifts. And throughout the whole day, if you can create or architect a day that's perfect within the realm of reasonableness, right? There's work in there and there's priorities, but create the perfect day. That's all there is.
And to me, it's the daily habits too.
It is.
Like you were talking about, it's like I had to learn how to go to bed at a reasonable time, not staying up all night long and wondering why I was suffering the next day. And all these things are part of. A lot of it is, it feels like you're growing up, and there's stuff in there that you rebel against, and some stuff maybe you could have been parented on when you're growing up, and that you're just learning as you're going through the recovery process. These
are big parts of it. You're hitting on the head. You're 100% right. It's not rocket science, but it's still fucking hard.
It is. Right, absolutely. And it's like, how do I have the internal discipline and not have somebody else telling me this is what I should be doing? It's like I have to, how do I become a stakeholder in this belief, in this process and stuff too? So
because I've had that same conversation with, I couldn't tell you how many 30-year-old men.
Exactly, right.
Like you need to get up earlier and go to bed earlier.
Exactly, that's right. You need to start the day. It's like you're not a victim of your day. You have a choice, and
but we have been for so long.
Totally.
Flying by the seat of our pants, going wherever the wind blows us, hoping that it all doesn't come crashing down, which is probably gonna anytime soon.
That's right.
It's a horrible feeling.
It is. It's a terrible feeling. It feels like life is controlling you, and you're not in control of your own destiny.
Yeah.
Now, the longer I've stayed clean, I don't know how much control I really have.
Sure.
But at the end of the day, it's I know what I can control, and and I also am a big believer in not leaking energy, I guess, for lack of better.
That's a good one. I like that.
Letting people kind of suck the energy out of me, and I have limited amount of time, and so I'm not going to get into debates where I know that I can't change somebody's mind. And so I'm not going to. If somebody wants to help, then let's chase after it. Otherwise, when you're ready, I'll be here. Sort of mentality. So.
I agree. There's very little I have control over. I have control over the words that come out of my mouth.
Correct.
And the actions I take.
Yep. Absolutely.
And they fucking matter. Yep. What I do and what I say matters. I thought they didn't for a long time.
No, it does. And I believe, and I'm a big believer, and my wife is a big believer in words. Words matter. So what does my self-talk look like right now?
Ooh, self-talk? You're going to go there? I love it. Let's hear about it.
Yeah, so I mean, ultimately, at the end of the day, it's what am I saying? Which am I using negative words? Or am I using the positive? This is, instead of I said it earlier, the victim mentality. And like life isn't. Actually, I just heard it on a podcast the other day where he was saying, what if we went from a victim mentality of feeling like things were happening to us, instead things were happening for us. And I was like, oh, that's a good way to reframe it, in the sense of that, I missed this job opportunity, but because I didn't get it, I'm here now because I missed that. And if I would have gotten that job, who knows where I would have been, but I'm much happier in this spot. So it was something that wasn't done to me. It was life doing something for me, where is that saying, God doing for me what I couldn't do for myself sort of scenario. So
those perspective changes, it's one thing when I have little moments, but like you're describing, when I work those little moments into intentional routine,
right,
that's when I really start to shift. There's actually a really great book. Her name is escaping me. I've read it. Gabrielle Bernstein.
Okay. She
wrote a book called The Universe Has Your Back.
Oh, I've heard of that. Yeah.
What a great title for a book.
Right.
And it obviously it's a good title for the subject
that
she's covering, but she's covering that subject.
Yeah.
Like, what if we could change our perspective from I'm the victim,
right,
this is all happening to me, to, you know what, maybe things might work out,
Right.
What if I lived with a little bit of intention, a little bit of positivity and optimism? Right. And I think with negative self-talk, combating that isn't, when I first started addressing negative self-talk personally, what I was imagining, my misconception was that I was going, what am I supposed to say, some fake shit that's not true, lie to myself? But that's not really what it's about. No. Healing negative self-talk is first about awareness. Like, just see if you can notice it.
Right.
See if you can write, and I challenge guys to do this, and it's just like someone challenged me to do it. See if you can notice and write down, just keep a ledger.
Right.
How many times you say something fucked up to yourself in the next 24 hours.
Sure.
And people, including myself, I lose count.
Right.
So, okay, once you can get your head around awareness, why don't you try modifying it to neutral? Neutral self-talk. Instead of saying, I'm such a fucking idiot, say, you know what? I'm new at this and I'm not good at it yet. Try that.
Yep.
You don't have to be fake. You have to create some artificial la-la land that's not real.
Right.
Why don't you just try being a little kinder?
Yes, exactly. Exactly.
Just a little kinder.
This is not the Saturday Night Live, the Jack Handy or whatever.
You're
Stuart,
good enough?
Yeah,
Stuart Smalley.
Stuart Smalley. You're good enough, you're smart enough, and gosh darn it, people like you. That was not epic. Yeah, and it ruined it for every therapist who wanted to tell somebody to do affirmations, because I think I agree. If I don't believe it, I'm not probably going to say it, but I agree. It's like, again, it goes back to what I say. It's those working in those margins. It's an incremental change. It's not going to be this big, giant change. It's these small little things, daily habits to incorporate that lead up to one big thing.
Yeah.
So,
and it's just like a savings account.
It is. That's right. You build up that bank account, and then
millionaires don't start off with $1 million.
That's right. That's exactly right. And then they can draw on it when they need to. So
NBA players don't get signed.
No.
Right.
No.
They don't just step into somebody's office one day and get signed.
Right.
They play basketball their whole lives.
Exactly.
Millionaires save their money.
Exactly.
And people who have strong, healthy habits, they develop them over time with next to nothing.
Yep. Exactly.
And I think that's a very mature perspective when you're looking at personal growth.
Right.
A lot of people won't join the gym because they're like, oh, I'll never look like that, or I'll never get the weight off, or I'll never fill in the blank.
Exactly.
And the truth is, everyone starts at some level of deficiency where they felt compelled, like, hey, I would like to change this. And once you start taking the action, that's when you start to understand, oh, I can change this, I can change this. And over time, it becomes routine, it becomes part of your life, and it becomes normal.
Yeah, and I've had that even in my recovery. I had to have the experience of go to the gym even when I don't want to, and give myself permission of, like, it's only going to be 20 minutes. And just getting my foot in the door was way harder. And that was the bigger metaphor for life, is like how much my brain controls this narrative of that it's going to be this awful experience, or I don't want to do it. And, like, the reality is like, you just got to go do it. The hardest thing is actually just taking that first step.
My wife and my oldest daughter and I spent 3 months in London about 5 years ago, and we stayed in Hackney Borough, which is this little area in East London, and we worked out at this gym, the Clissold Recreation Center or something, but they had a gym. It was the closest to where we were staying, and we worked out there every day.
Right.
And I used to train with this guy from Brazil, so he spoke Portuguese, and his English was very broken and with a heavy East London British accent, so he was really hard to understand. Heart of gold. The guy's amazing. Right. But we used to train together, and he used to, right in the middle of a tough repetition, he would say that you listen to your body, you don't listen to your mind. And it kind of it's rung in my head a lot over the years, the last 5 years. Listen to your body, don't listen to your mind when I'm in the gym.
Sure.
And I think it's that way in recovery too, because there are so many times, especially like say my first 6 months, where I just wanted to run. I didn't even know where I wanted to go.
Yeah. Right.
I didn't even know I didn't have a plan. I just was uncomfortable being me in my own skin. And all I did was stay put, even though my head was telling me to go. I didn't listen to my head. I just stayed put, and my head was just crazy.
Yep, exactly, and that's right. I remember not sleeping my first year. It felt like it was it was like an every night
struggle.
Yeah, why am I not falling asleep? Yeah, exactly, and just my mind is just racing, and it's like I just can't even shut my mind off. So that just seems like that's an early part of recovery.
What do you do for sleep now? Do you fall asleep easy?
Yeah, for the most part, I do. Yeah, so sleep, I try to get to bed at the same time every night, regardless, even if it's the day off the next day. Mostly children have made that a priority because I don't want to wake up at 5 a.m. after going to bed at midnight. But for the most part, you're right. The reality is like I try to read, and reading puts me to sleep, and that's kind of my go-to is I'll read before bed, and then just it puts me to sleep. So, and I don't have a problem falling asleep anymore, but it was a struggle.
Oh gosh.
Early in the beginning, it was like, it just felt like all I was doing was either replaying conversations that I'd had with people or what I was going to say to somebody the next day or whatever. And just, that is not an issue.
Yeah, no, for me, this was the same. Early recovery, as soon as I would lay down, my head would torment me.
Right. I'd feel tired.
Oh,
and I couldn't go to sleep.
I was like Ed Norton in Fight Club.
Yes, that's exactly what it was. That's it.
Borderline insomnia.
Yeah, absolutely. And I can understand the insanity behind it. And then all of a sudden the sun would come up and I'd feel different.
Yeah.
So I think that's a big deal for sure. And part of that is the self-care piece of what you're talking about, is going back to having that routine of like, what do I do on a daily basis and trying to stay connected in that regard. So... But it's easy now. I mean, I've got my routine. Like we were talking about earlier with the coronavirus is that, what do people do now for how do they build a routine if they've never had to have a routine? And if people can't be there to help mentor them and stuff, that's really the big goal. So
we haven't had any slowdown here as far as people asking for help.
Sure.
What have you, any trends you've noticed since COVID and shutdowns, most of this year so far? Any big shifts in treatment that you've seen?
Well, I mean, for us, we had to make some adaptations really where we were having a lot of outside meetings. So we were pretty open campus where we had visitation and we would have our H&I meeting. So that's the hospitals and institutions coming in. So that's the 12-step meetings coming in to present and sponsors coming in. And so most of that we stopped. So those were some of the changes that we've had to change, and ultimately we thought visitation would be a bigger problem, but we gave people their cell phones so they could do FaceTime with them, and so that kind of alleviated that missing of family and stuff too. So, and then overall the slowing down, absolutely. Either people are more afraid of going out or whatever, but really for the most part we really haven't seen a huge slowdown.
And you mentioned before we started that you guys are testing everyone that comes in through detox.
Correct. That is correct. So all of our residential care, we start out with the nasal swab testing. So that's before they can get onto detox, they are going to get tested, and we've got a company that turns around our results pretty quickly. So everybody's wearing a mask and stuff. So that's...
Yeah, I've been over a couple times. Everybody was masked up.
Everybody takes it pretty seriously. So,
But no real slowdown on admissions.
No, not at all. Like we were saying before, it's been kind of our topic when we've talked to our patients and stuff, is just as a reminder that alcohol and drugs have killed more people than coronavirus has to this day. And so I think that's the reality behind it is that people still die from this disease.
And here's what's scary, because coronavirus is scary. No doubt, it came out of left field. It started killing people who weren't prepared for it.
Right.
I think everyone's on the same page there. But you're right. At some point, whether it's in 6 months from now or in 6 years from now, at some point we're going to develop a vaccine, and coronavirus will, give or take, be a thing of the past.
That's right.
Will deaths from drugs and alcohol? I don't think so.
No.
I don't think we're ever, because unlike viruses, we had scare with Ebola years ago. Unlike these viruses, drugs and alcohol there's an allure to them when you're young, which is strange that it's so accepted socially to drink or to say smoke weed or something like that, and even like maybe depending on the circle you're in, maybe even harder substances. But yet then there's so much shame around it getting out of control. Well, this shit gets out of control pretty easy for a lot of folks. This is the big question. Why is there so much shame around someone who can't handle their alcohol or drugs?
I don't know. I have no idea on how to even answer that question. I just think that some of it's the stigma. I think that it goes back to the mental health, is that we do not make it a priority from that standpoint, and it's not the movies don't necessarily glorify it, and the news doesn't talk about the getting help side. The news wants to focus on the fact that it's more people fail in 12-step recovery than anything else, and I think that's a bigger issue. And I think until you get bigger names talking about their own recovery struggles, the only issue that I would see there is if they relapse, and then then people can point to that as a failure or whatever too.
Brad Pitt's been pretty open lately.
Yeah, he has been. Yes,
I'm pretty sure he said he joined 12-step recovery.
I heard that too. Yeah, and he's talking about him smoking pot and drinking, and could have caused his divorce. So
sure. Well, and I agree. I think more people doing what we're doing today, and that's just talking about it.
Right.
Because it's killing people.
It is.
And isolating and not talking about it and being ashamed of it is killing people.
Right.
And here's a statistic. If you can stay in a structured recovery environment for 12 to 18 months, we're talking treatment, 12-step programming, sober living, etc.
Right.
Seeing a therapist. If you as much of that as you can stack together inside of 12 to 18 months, if you can do that, your chances of staying sober permanently the rest of your lifespan are over 65%.
Yeah, it's incredible.
Treatment for alcoholism / addiction is actually really, really effective. And yet you got heart disease. Heart disease treatment isn't 65% effective.
No, not at all.
No, and liver disease. We treat people that are on waiting lists, liver transplant waiting lists here.
So do we. Yeah.
And it's like, if you could tell that guy 65% chance this is going to work out if you just do this shit for the next 12 to 18 months.
Exactly.
I mean, we do tell them that, and they're like, "Cool. What do I do next?"
Yeah. Yeah.
But people don't always have that information.
No, and well. And some people do get that information, and it's figuring out how do we get them to believe it, you know. And the reality is sometimes people are too smart for their own good.
That's true.
You know, they need to
I have met some that were too smart.
Yeah, and they don't want, and they think that their way is going to be the right way. They're going to research it to death, and it's that paralysis by analysis, and they're not going to get it, you know. And I think we're changing, evolving in this society right now, where we need to focus on the shame behind getting sober and asking for help. And the reality, you're right. On one hand, it's promoted as being really cool to go party, and that's the expected thing to do in college and high school.
Absolutely.
But that's what I expected. That's what I thought was everybody else was having fun, and I was at home missing out on all the fun. And
if you drink beer out of a funnel and you're 19 or 20, that's
a normal,
fairly acceptable.
That's good college fun, and it's fairly acceptable.
No one's going to be too mad at you for that.
Not at all. Not at all. When you're 40, people are going to probably have an issue with it. But at the end of the day, it does get out of hand. It gets sideways really quickly, and how do we make it okay? I think we have some stereotypes out there that we need to kind of break down. Because I remember when I was first getting sober, and I was like, I'm not an alcoholic. What are you talking about? This is like
I don't even look like one.
No, exactly, right. Exactly.
I don't even look like an alcoholic.
No, I don't look like I'm homeless or whatever, and whatever the picture I had in my mind was not. Yeah, that was not me. And so, it's breaking down that stereotype that it can be anybody. So,
and that I think is still hard for people, and I think you're nailing on the head. I think having an open conversation about what drug addicts and alcoholics look like, what they act like, is one of the best ways we could help reduce the stigma and save more lives.
Right.
Because people, here's numbers from 2018. More than 1 million people did not get help that needed it. This is documented. So there could be more. That's an approximate number. And roughly 40%, about 400,000 Americans didn't get help in 2018 specifically because they were afraid.
Right.
They were afraid of stigma. They were afraid of shame.
Right. And I think
boss, their spouse, whoever.
Yeah. Well, I mean, I think we also have set it up structurally and economically that people's jobs are dependent for healthcare, and this industry is dependent on insurance. So if I don't have a job, I don't have insurance, and then I can't go get treatment. You know, and so
or you can get Medicaid, but Medicaid treatment facilities aren't usually very awesome because they're living on they're trying to treat one of our oldest, most deadliest illnesses.
Right. With bare bones,
with very minimal. I mean, it's shoestring budgets.
It is, and there's a huge waiting list too.
Huge waiting list,
and so
every Medicaid place in town has a wait list.
That's right. They're all full, and
COVID running rampant.
Yeah, COVID running rampant.
I won't name any names, but I heard about one of the big ones, and they've had dozens of cases.
Yeah, exactly. And that's
because they're helping everyone they can. They're trying not to shut their doors.
Exactly.
They're trying to help these people that have nowhere else to go.
Exactly. That's right. And so with that, I mean, it's scary. So I think that's a bigger systemic issue too, is trying to figure out how we can get help. How do we help people with, low socioeconomic? And then I think it's a bigger issue than just drugs and alcohol. I think at the end of the day and that's what we talk about in 12-step meetings too, is that drinking and alcohol are just a symptom of of what it is. It's just masking what's really going on. And so again, going back to our behavioral health conversation and talking about that, is it's okay to ask for help, and then building that in. And I think some companies are figuring that stuff out of how we get there.
That's a you just said something that I think is worth unpacking a little bit. Drugs and alcohol aren't necessarily the problem. They're the symptom. Mm-hmm. Why don't we talk about that a little bit for anybody? Because the idea of this podcast is to do what we're doing, and that's talk about this shit. And I think that's very specific to someone who may be new to recovery. That might be an interesting, what do you mean drugs and alcohol aren't the problem?
So oftentimes we'll see people who give up drinking and drugs and still have the same behaviors, and so they're still lying, or they're still cheating, or they're still doing things that we would not consider as part of a normal part of society. Or I'll speak for myself, is that I give up drugs and alcohol, and then sugars becomes a bigger thing, and then people blow up their first year because they're eating a bunch of candy, and they're fixing it's really trying to fix a feeling within myself that I'm so uncomfortable. You said it earlier, that so uncomfortable in your own skin, and you're just trying to find anything that could be. You'll often see there's a reason that we in recovery talk about don't get into a relationship your first year, because all of a sudden
sex and love don't fill that hole.
No, that's right. Sex and love don't fill that hole.
Oh, it's a lot of fun to try.
Yeah, it is. And try
credit cards.
Yep, exactly. Gambling. All of those are other. It's very similar to the whack-a-mole game. It's like you give up drugs and alcohol, and then all of a sudden you find out that you're a love addict or a sex addict, and it's all about getting yourself outside of that moment and getting outside. I'm so uncomfortable with myself, I will do anything addictively and compulsively to make myself feel better. So we give up the drugs and alcohol, and then spending addiction kicks in, and I can't stop shopping on Amazon, and I've got packages that I haven't even opened up yet. And so it's the crazy, it's the high, it's the chase. And one thing that I do share about in my recovery is, I remember driving to the dope dealer's house and feeling, I was already high mentally with the dopamine from my brain, which is probably more powerful than any drug out there. Just thinking about getting high, and then getting the drugs in my hand was not as fulfilling as the thought of driving over to the dope man's house to get the package, and then it was probably not nearly as satisfying as the fantasy that I made up in my brain and stuff.
I've had the same exact experience.
Yeah.
I was attending a court-ordered IOP. This is in the 90s. I got sober in 2004, so this is like 7 or 8 years prior to me getting sober. I'm trying to get sober. In my mind, I'm sober. I'm drinking 40-ounce bottles of malt liquor at night only, and smoking weed. To me, that's sober, right? So I'm I'm in IOP with this other dude who will remain nameless, and we're staying sober together. We're going to IOP. We're going to work. We're going to IOP. We're kicking it at the apartment. Drink a 40-ounce, a couple of cigarettes, call it a night.
Sure.
We're behaving, and in the world I come from, that's behaving pretty well. And neighbor came over. I live in a shitbox apartment complex, just a hellhole. So all my neighbors, give or take, are pretty shady. I have a neighbor comes over, says, "Hey, I don't have any use for this." Literally gives us a half gram of methamphetamine. We didn't even have a pipe to smoke it. We cracked a light bulb, and we're struggling to get it in there. And both of us look at each other, and he was like, "I'm already fucking high." I'm like, "Me too."
Yeah. Just the thought of that first hit. Yeah, exactly.
And then we did it anyway.
Yeah, of course.
But we were right there. Yeah. Heart was pounding.
Yep. Exactly. It's just the thought, and the heart is racing, and then you get it, and you're like, but that was kind of the catalyst for me for getting clean. Was I could go there, and I was higher than going to go see the dope man, but the after effect is I couldn't get out of my pain and my discomfort. It's I couldn't get high enough to make all those feelings go away. I couldn't stop my brain enough to shut it off. And that was kind of the cue for me, was like, man, this is not working right now. I can't get high enough.
Same exact experience.
So, and that is a bottom, but unfortunately a lot of people don't get there. So, I mean, and then obviously through recovery, you start finding out the other isms that are kicking in. So,
well, I think when you're definitely talking about it, this is the heart of it. I don't do drugs and alcohol to party or to feel good. Right. I do drugs and alcohol to not jump off a bridge.
Correct.
I do drugs and alcohol so that I can face the day.
Correct.
Whatever that looks like in anyone's current circumstances.
And that was I didn't mean to cut you off, but that was my baseline. Like, my baseline high, or my baseline was like to smoke pot during the day and maybe drink, and then I was open for business after that. That was like my baseline of an all day, like an every day. It was like guaranteed those were the two things that were going to happen, and then anything else that came along, I was game for. And part of it too was getting a little bit older. I went back to school when I was 21, and I started hanging out, and people were only 3 years younger than me, and I was listening to 18-year-olds talk about partying, and I was like, wow, you guys don't party like me, and I don't really get what you're talking about, and I feel older than you, and this is a strange phenomenon that's going on right now, and I don't feel like I fit in, and I can't get high anymore. So this is all fucked up, and I am not happy about any of this.
Yeah, I was trying to get sober when I was 19. I tried again at 21, and then I tried many times until I was 26.
Right.
Almost 27 when I got sober.
Yeah. And the most important thing is you didn't quit quitting.
That's right.
Right? So you just kept coming back and kept trying, and it takes what it takes. It's a weird shift.
It really is. And I think, that's the old joke, is that it's what do you get when you sober up a drunken horse thief?
What do you get?
A horse thief.
Exactly.
So we've got a lot of dysfunction that needs to be sorted out.
Right.
A lot of knots to untie.
Yeah. Right.
That have very little to do with drugs or alcohol.
And those knots to untie are those limiting beliefs or thoughts, or
the negative self-talk, the dysfunctional family system.
That's right. Exactly.
The childhood trauma. Let's not even talk about fucking trauma.
Yeah, exactly. Well, and that's the big deal. I mean, to me, that was a big shift for Calvary, is when we shifted to, because I'm a huge believer, only because I don't think that I would stayed sober had I not done family of origin work.
Right.
And that was the game changer for me. Was like, I needed the 12 steps, but I also needed to look at my history and heal my own inner trauma and so on. So
agreed. I listened to a podcast of this gal in recovery, and she had been raped as a child, and she says, I forget how she put it, but she had talked about getting sober and people kind of parroting this, our parents do the best they can with what they have.
Sure.
And she said that only got her by for a couple of years, and at some point she had a breakdown. She had to go to therapy, and she got into therapy, and guess what they told her? It's okay for you to be fucking angry about what happened. And they were able to coach her through allowing herself to experience the resentment, the anger, the pain, and then healing through that process genuinely and authentically came to a place where she could say, you know what? They did the best they could with what they had, and she was truly able to move on. Not only stay sober, but not, just have a thrive, have a good life.
Yeah.
And I can identify with that. There were a lot of things that I wouldn't allow myself to really feel until I started going a little deeper.
Right. And I would agree with that too. I mean, that's such a powerful thing, because we as a society basically say it's not okay to be angry, and not to feel your feelings, and you're supposed to look perfect, and you're supposed to be this certain way, and it's very difficult to live up to all of the rules that our parents teach us and society teaches us, and it's a recipe for insanity, and so that's the most important piece. And really, at the end of the day, it's like we're being codependent, and the codependency is I'm dependent on you to make me happy, and you are dependent on me to make you happy. And if that's how I'm living, that sounds like all of my relationships, whether that was friends or girlfriends or whatever. It's like I'm going to hold somebody hostage because you make me feel a certain way, in this whole idea.
And it's just like the drugs and alcohol. It's just like the sex. It's just like the gambling. It's just like the food. And that's why it happens when often, not always, but a lot of times when people get sober, guys and gals, they get sober. They put, how does it go? You put down the bottle, you pick up a fork.
Yes, exactly.
You put down the fork, you pick up a credit card. You put down the credit card, you pick up Tinder.
Right.
Whatever however it goes. But that's what we do. It's a whack-a-mole.
Yep, it is.
Because we're not really talking about drugs and alcohol specifically as we're talking about a misalignment between values and actions.
Right.
I do not live up to the type of person I believe deep down I would be.
Right. And I believe that, and part of that too is like, I think that that's good for you, but I could never do that. That's part of that negative self-talk is like, it's amazing that you can do that, but I could never be that.
You're so inspirational.
Yeah, exactly right. All these things. And the reality is like anybody can do it. I believe in everybody can change. It's a matter of a little bit of that want to and asking for the help. Actually, I heard Hugh Jackman on the Tim Ferriss podcast we were talking about before, and he was talking about how in Australia, because he's from Australia, that they make fun of Americans for always having a life coach or a therapist and all these things. And he looked at it a little differently when he came to America. Was that he looked at it, he said, well, Pavarotti had a voice coach till the day he died, and he actually views it as a strength that Americans ask for help.
Yeah, he gets coached personally by Tony Robbins.
Yes, exactly. He's like, I have my own life coach.
He's like the life coach.
He has the life coach. The inventor of life coaching is Tony Robbins, and that's his life coach. But yeah, that's his whole thing is like, we need our coaching. We need somebody to help get the best out of us, and that would be how I would define a coach. And so,
yeah, I couldn't agree more. We need help. All of us need help. Even successful people need help. We need guidance. We need someone to vent to. We need somebody to bounce ideas off of.
Exactly. Right.
We need each other. We need this human connection. We need to have this experience together. Right. That's how we improve.
And I agree. And I also think we need somebody in our life who can tell us no and tell us when our shit really stinks. Because we have just a big echo chamber of people telling us how amazing we are. We're not going to ever grow. We're not going to get better.
No.
And then when the facade comes down, it's like, well, why didn't anybody tell you? Well, tell me. It's like, well, maybe I didn't have the right people around me.
Yeah.
So I think that's important too. So I think that for me, I have that kind of support group where it's like they know me. I mean, that's another piece that I talk about with when I share in meetings or whatever, is that, you need to have a support group that's as strong as your sponsor, where they're going to call you out on your shit, not just co-sign it and just go along with it. And because I got friends who are like, I'll want to go complain about my wife or my kids, and they're like, yeah, well, let's look at your behavior and what you said to kind of start this whole thing. And I'm like, oh, okay, I guess you have a point there. Really what I want is somebody to bro up with me and say, no, this is totally fucked up and you're in the right and stuff. And that does not happen. I think that's like a good support group.
It's fantastic. I go to the same type of groups, men's accountability groups, where we talk about gut level, like what's going on in our lives, and then give each other feedback, honest feedback.
Yep, exactly. No,
and it's not always, oh, dude, you're so great. Sometimes it's like, have you considered looking at it from this perspective? And it's like, oh shit, here we go.
Exactly, that's right. Exactly. I know I'm in trouble when I get that.
Yeah.
Exactly. No, that's an important part of the recovery for me, and I think that part goes back to our isolation pieces. Like, how do you build that connection?
Over Zoom?
Yes, over Zoom. Exactly.
Band-Aid on the head wound?
Yes, exactly.
You can, but it's difficult to build it. I think I do think I think it can fill in the gap for people that are well established.
Sure.
And I don't know how to encourage new people to do Zoom meetings. We do, obviously. I encourage people to get on Zoom meetings. I also encourage people, and I'll encourage anybody that's listening to this or watching this, try calling the central office for a 12-step meeting in your town.
Sure.
I would say get on Google and just Google search 12-step meetings near me.
Right.
And if there's a phone number, call the number.
Yep.
What you'll find out there is you'll find directories of Zoom meetings. It's not well established, but it's starting to happen.
Right.
You can get on Zoom meetings. I know it'll probably uncomfortable and weird, but I hope you do it. Also, the more you get into the 12-step groups and fellowships, you'll find that some of them do meet in person. Some of them do meet in parks. There are some meeting halls that are open.
Right.
Some of them wear masks, some of them don't. I mean, you got to figure all that out in your city, in the place that you live. And I feel very fortunate. Like the lunch bunch over at Crossroads, they're still meeting. They don't meet in the Crossroads; it's all shut down. But they meet at the park.
Right.
I didn't even know that they meet every day.
That's amazing. Yeah, no, that's fantastic.
I don't think you get lunch anymore.
No, that's not the perk.
No, but I think that's what I would encourage anybody that's listening or watching.
Well, and I think that's really kind of goes back to the key is that even when there's meetings out there, and I think that we're very fortunate where we are in this part of the country. Southwest has some of the best young people's recovery, let alone recovery, that there's a meeting 7 days a week, 24/7, is that even though we have meetings 24/7 with that newcomer, there will be a million excuses as to why they can't attend a meeting. And so the social isolation just becomes a convenient excuse, because regardless, even if it's a Zoom meeting, you should still try to put yourself out there.
Absolutely.
And still throw yourself out there, because it's like there's somebody out there who's dying. There's always that one person in a meeting who wants to help the newcomer. So it may not be me or it may not be you, but at the end of the day, there's somebody in there, that's their jam, and that's what they were put on life to do, is to get to that AA meeting and help that newcomer. And if you throw it out there, you'll find that person. So always.
Before we wrap up,
sure,
give me a minute. Anything at all you want to say right here?
Recovery is possible for anybody. I fully believe that if you go to a meeting and you ask for help, you will find it. And powerless does not mean that you were powerless, and it's not a negative statement. It's a part of humility. And humility is the key to staying clean and sober. And just remember, we can't change how the beginning happened, but we are in control of how the ending happens. And so every day can be a new day, and we can absolutely make our lives better every day by, taking a change, making that change every day. So that's what I got.
Right on. That's good stuff.
Cool.
Well, Brian, thank you so much for being on today, and look forward to seeing you around soon.
All right. Awesome. Thanks, Russell. All right. Thanks.